I'm having Botox and then next month a vampire facial. Will the facial break down the Botox? Botox 1 month before a vampire facial. Is there any benefit for the patient?
Thank you for your question. You're having Botox, and then about a month later, you're going to have the vampire facial. And you're asking, will the vampire facial break down the Botox? Well, I think that's a very good question, and I can certainly give you an understanding as to how each of these procedures work so you can understand the impact of the timing of these procedures. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. In fact, our specialty was one of the first to use Botox, so I've been actually injecting patients with Botox since 1993. And I'm also a member of the Vampire Facelift Network, and I've been a media resource for opinion on the Vampire Facelift and Vampire Facial, particularly when certain celebrities find that are doing the procedure, and then people want to get an opinion of about the procedure. So that being said, let's go over the details of how Botox works and how the vampire facial works. Now, Botox, which is, I believe, the most popular non-surgical cosmetic procedure, the use of this product, Botox as a product, is significant. And so there's a lot of benefit to this drug. The other drugs that are similar are called Dysport and Xeomin. But essentially, they all work with the same idea. And what they do is they block the signals between a nerve and a muscle. So that, for example, when you squint your eyes and you get crow's feet lines, you're relaxing a muscle. So the point of that is that the level in which the Botox is being placed is at the muscle level. It's actually an injection into the muscle. Yes, you can inject it above the muscle and you can still get benefit, but that's the zone. So you think about it, it affects the muscle, not the skin directly. The benefits to the skin is to relax the wrinkles that form when those muscles are activated. So that's true for the wrinkles, the frown lines, and for the many other ways we use Botox. So that brings us now to the vampire facial. The vampire facial is a variation on the name vampire facelift. The difference is that with the vampire facial, you're using platelet-rich plasma, but as opposed to injecting it under the skin, and platelet-rich plasma is derived from your own blood. It's the wound healing and growth factors which can actually be of great value in improving skin quality and texture. With the vampire facial, what you're using is a microneedling device. That microneedling device is penetrating the skin but not going all the way through to the muscle. Therefore, the idea is that if you do microneedling at different layers of the dermis, the backbone of the skin, you can stimulate a collagen response, and that results in skin textural quality tightening. It also, because it's entering the epidermis, it stimulates new growth of new skin through this injury model. But with platelet-rich plasma, it appears to augment the benefit of the microneedling device. In other words, you're using a wound healing material that's now entering the skin through the pores created by the microneedling device and stimulating collagen, stimulating blood supply. It's a very effective way to help improve sun-damaged skin, fine lines and wrinkles, and improve skin quality and texture overall. In so many ways, even well-known dermatologists who used to advocate every laser that came out for years have recently acknowledged the remarkable value of microneedling. So the world comes full circle sometimes. With that understanding, you can appreciate that the levels are different and that the effect of the Botox, if you think about it, the onset of the effect is usually within the first 3 days, and then it peaks at about 2 weeks, which means that by the time you get to a month, the effect of the Botox is already working. So there's nothing to worry about in terms of dilution. There's nothing to worry about displacement or some type of negative effect on the longevity of the Botox. I think this is a very good combination. It's a great synergy, relaxing muscles and doing something for skin texture. Many years ago, long before a lot of these developments, I was featured on the morning news with the idea of combining Botox with, at the time, the erbium laser, so with the idea that you can combine something that reduces the activity of the muscle, that causes deeper lines, and then do something to improve the fine lines and cause the skin to tighten, and also have the synergy of the lack of action of the muscle to help smooth the skin even further. So you're definitely on the right track from my perspective. So I think it's completely, bottom line is, I think it's completely good for you to do that. I don't think you'll have any negative outcome on the longevity of the Botox, and hopefully this will work out well for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.